Knock, knock.
Come on in.
Hello. My name is Christina. I am a nurse and I'm going to be assisting you today. Can you tell me your first and last name, please?
Anthony Butler,
Okay. And what is your date of birth?
June 3rd, 1971,
Okay. Can you tell me where you are right now?
in a doctor's office.
Okay. And what day of the week is it?
Sunday.
Okay. All right. So tell me what brings you in today.
Physical assessment.
Physical assessment. Okay. All right. So what I want you to do is undress and put this gown on, and I'll give you a couple minutes. I'll be right back.
Okay.
Okay. Knock, knock.
Come on in.
Okay. All right. And so I'm just going to wash my hands real quick, okay, before we do the assessment. And I'm going to put on some gloves. Okay. So what I'm going to do today is just a head to toe assessment. Okay. I'm going to start at your head and work down and check you out completely. Okay.
All right.
And do you have any questions before we begin? Okay. Just look straight at me and hold your head down a little bit. I'm just going to check your head. I do see some balding. Um, Your head feels symmetrical. I don't feeling any um, lumps or anything. Okay. Do you have any problems with your scalp?
Dandruff sometimes.
Okay. All right. And the next thing I'm going to do, I'm going to check your ears. Okay.
Mm-hmm.
So I'm going to look in. Any pain in your ears?
None.
None. Okay. Ever have any drainage or anything?
Mm-mm.
Okay. I don't see anything abnormal there. The tympanic membrane is intact, and I don't see any fluid or any bulging, any signs of infection in there. I don't see any drainage. Okay, let me check the other one. Okay, and that tympanic membrane is also intact. No bulging, no fluid, no signs of infection. Any pain in this ear?
Mm-mm.
Okay, and I don't see any drainage either. Okay,
Mm-hmm.
all right. You can look at me. I'm going to check your eyes. Okay. Um, I see that your pupils are, they're both round and equal. Now I'm going to check how they respond to light. Okay, so just look straight at me. Okay, and they are reactive to light. Can you follow my finger? Just my finger with your eyes. Okay, and they are accommodating. All right, I'm going to pull down on your, very gently on your lower lids. Look up. Okay, the conjunctiva is clear and sclera is white. I'm going to pull up on the top lids. You look down. Okay, and all of that looks normal as well. Okay, next thing I'm going to do, I'm going to test your extraocular muscles. So I want you to follow my finger just with your eyes, okay? Not with your head, okay? Okay, that's good. All right, and next I'm going to check your nose. Can you hold your head back, tilt it back a little bit? Okay, I'm going to look up in your nose. Okay, nasal mucosa looks normal, looks is pink and looks moist. Do you have any problems with nasal drainage or any problems breathing through your nose?
Just when, seasonal.
Like some seasonal allergies?
Yeah.
Okay. All right. And I'm going to check your mouth. So can you open up and say ah? Okay. All right. That's good. Now just look at me. Open your mouth. Lift your tongue up. Move it to the right side, the left side. Okay. Stick it out as far as you can. Stick it out as far as you can. There you go. Okay, perfect. Thank you. All right. Your tonsils are equal. They don't appear to be swollen.
Mm-hmm.
I don't see any redness
Mm-hmm.
in your throat. The uvula is it moves up and down as it's supposed to. Okay. Any problem swallowing? All right. The next thing I'm going to do is I'm going to check your lymph nodes. So I'm going to just press lightly. Any pain in there?
Mm-mm.
Okay. Down. Kind of feeling. Okay. I don't feel any lumps or nodules. Okay. All right. And let me see. Okay. So your trachea is not deviated or anything. It's symmetrical. It's midline. I'm going to check your thyroid. So I'm going to step behind you. I'm going to place my hands around your neck, okay?
Mm-hmm.
And I'm going to let you know when I want you to swallow. Okay? Can you swallow for me? Okay, great. Okay. The thyroid doesn't seem to be enlarged or anything. Okay. All right. The next thing I'm going to do, I want to check your cervical spine. So I want you to tilt your head back as far as you can. Okay. And then I want you to put your chin on your chest. Okay. You can look back at me. Look to your right and then to your left. Any pain? You hold your head down. Where does the pain? Where do you feel the pain?
Like at the bottom part of my neck.
Okay. Can you put your finger where?
Right here.
Right in here.
Mm-hmm.
When you push down. Okay.
Mm-hmm.
All right. Okay. You can look back at me. All right. I want you to. I'm going to check your shoulder strength. Okay. So shrug your shoulders up. Okay. And push them down. Okay. All right. All right. The next thing I want to do is I'm going to listen to your heart, and then I'll listen to your lungs, okay? But right now, I just want you to breathe naturally while I listen to your heart, okay? Okay, I'm going to listen for the aortic sound and then pulmonic. I'm just going to use my fingers to measure a little bit, okay?
Mm-hmm.
I'm going to listen at Herb's point. And I'm going to listen to the tricuspid. And I'm going to listen to mitral valve. Okay, your heart sounds are normal. I don't hear any extra heart sounds. Um, Now I'm going to listen. I'm going to do that again, but I'm going to listen a little differently with the bell of my stethoscope so that I can listen for any murmurs. Okay?
What that mean?
I'm sorry?
What does that mean?
Hmm?
What does that mean?
Any heart murmurs?
Mm-hmm.
It just is abnormal sounds of your heart.
Okay.
And it could, it could indicate that like the valves aren't closing like they should. Okay?
Okay.
Just sit straight up. I didn't hear any murmurs. Have you ever been told that you have a murmur? A heart murmur? Okay. All right. The next thing I'm going to do is listen to your lung sounds. Okay. So I'm going to listen to 6 areas on your chest in the front, and then 6 areas in the back. Okay.
Okay.
All right. Take a deep breath in and out. And again. And again. And again. And again. Again. going to listen to the posterior of your back. Breathe in and out. Again, 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 and one more time. Okay, right. Your lung sounds are are normal with they're normal on both sides. So bilaterally, I didn't hear um, any signs that you have any fluid in your lungs or any infection or anything. Okay, no wheezing. Um, do you have any history of any breathing problems? No. Okay. All right. The next thing I want you to do is hold your arms out. Okay. And I'm gonna push down, and you push against me. Okay. Okay. And now we're gonna do it the other way. I'm gonna push up, you push down. Okay. Now I'm gonna push outwards, and you push against me. Okay. And then I'm gonna push inwards. Hold your arms out. Like, okay. I'm gonna push inwards, and you push against me. Okay. Great. And squeeze my hand. Well, squeeze my two fingers. Squeeze. Okay. All right. Um, your muscle tone is 5 out of 5. So you have a strong muscle tone in your arms and in your hands. Your hand grips are equally bilaterally. Let me see your hands. Let's turn them. Okay. I'm going to check your fingernails and check your capillary refill. That just lets me know about circulation. Okay, and your capillary refill is less than 3 seconds. Okay, and your nails are clean and short, and they're trimmed. Okay, I don't see um, any abnormalities on your hand. Now I do see that here you do have something looks like a ganglion cyst. How long has that been there?
I don't know, for a few years.
A few years. Okay. They usually don't um, cause any problems. Does it hurt, or do you just kind of forget that it's there?
Yeah, I don't know.
Okay. Okay. So we'll move right along. I'll just have you lay down for me
Now,
with with your head on the pillow. I'm gonna check um, your midsection. Okay. Just put your hands down by your side. I'm gonna fix your gown for you a little bit. Okay. And so what I'm gonna do now, I'm gonna listen before I palpate. Okay. Um, so I'm gonna auscultate the vowel sounds in all 4 quadrants. Okay. Okay. All right. Do you have any digestion issues? Any nausea, vomiting, diarrhea, constipation, anything like that?
not really.
Not really. Okay. All right. So I'm just gonna feel around. Any? Do you have any hernias or anything?
Yeah, I have what is biliary hernia.
Umbilical hernia.
Yeah,
Okay. And where's that?
it's right there on the navel
Right
edge.
there. Okay. Any pain there?
Mm-mm.
Okay. Any pain when I touch your belly?
Mm-mm.
Okay. All right. So the next thing I'm gonna feel your liver. Okay. So I'm gonna check your liver. So I'm gonna put one hand under and one hand right up under the bottom of your rib cage. Okay. So I want you to take a deep breath and then exhale. And when you exhale, I'm gonna press down gently. Okay. Exhale for me. Let all the air out. All the air out. Okay. I'm gonna press in. All right. Any pain in there? No. Okay. All right. And over here, I'm gonna check your spleen. Okay.
Mm-hmm.
All right, I want you to do the same thing. I want you to take a deep breath and then exhale, let all the air out of your lungs. Okay, any pain in there? Okay, and I cannot feel your spleen, so that's a good thing. Okay, All right. Um, any um, any pain anywhere
My back
in your
is
back
in
from
pain.
laying down? Okay. All right. So the next thing I'm gonna check your hips. Okay.
Mm-hmm.
So I'm gonna pick your leg up and I'm going to bend your leg. I want you to bend it up as far as you can. Any pain there?
Mm-mm.
Okay. All right. And I'm gonna rotate it inward a little bit, and then I'm gonna rotate it outwards. Any pain there?
Oh.
Okay. Let's do the other leg all the way up. Any pain there?
Mm-mm.
Okay. I'm gonna bring it inwards,
Mm-hmm.
and then I'm gonna push it outwards. Any pain there?
Mm-mm.
Okay. All right. Let's see your legs. I see that you do have some scars on your legs, maybe just from some old injuries. Okay. Any skin concerns that you know of?
Mm-mm.
Okay. All right. Now um, I want you to flex your feet to your body, to like to towards you. Okay. I'm going to try to push against that. Okay? That's good. All right. Now we're going to go the other way. I want you to flex them. Yep. Down, and I'm going to try to push them up. Okay. That's very strong. Okay. All right. And okay, now I will have you sit back up for me.
Right now.
Well, in just a moment, I just remember something. I'm going to check the way I checked your fingernails. I'm going to look at your toenails. So your toenails look good. They're a little thick, um, but I don't see any signs of fungal infection.
Okay.
Okay.
You want me to
So
sit?
no, that's okay. I'm going to check your capillary refill on your toes.
Okay.
Okay. And they are less than 3 seconds.
Okay.
Okay. Um, so yes, you can sit up now. Okay. Now I'm going to go back through and I'm gonna check all of your pulses.
Okay.
Okay.
Yep.
All right. So if you look just straight ahead at me, I'm going to check. I'm not going to check your carotid um, arteries at the same time because that can make you faint. So I'm going to do one at a time. Okay.
Mm-hmm.
All right. So I'm going to just feel. Okay. Okay. And so they're both +2. That's normal. All right. And I'm going to listen. Okay. And that sounds normal. I don't hear um, any abnormal sounds. Okay.
Mm-hmm.
And then I'm going to check your brachial pulses. Those are up here in the biceps. Okay. Those are +2. And I'm going to check your radial pulses. Might be a little difficult with that ganglion cyst. Feel it below there. Okay. All right. And I'm going to um, check your femoral pulse. Okay, that's kind of in the groin area. So I'm just gonna do like this, and the popliteal pulse, which is behind your knees. I'm gonna feel those. Okay, that's good. Those are +2, and I'm gonna feel the tibial pulses. Those are +2. And then I'm going to check your fetal pulses. Okay. And those are +2 as well. Now, do you ever notice any, ever have any numbness or tingling anywhere in your arms, legs, hands, feet? Nothing like that? Okay. All right, let's put your gown. All right, now I'm going to check your balance. So I want you to stand up for me. And if you will, um, just kind of walk a few steps for me and turn around and walk back. Okay, great. And just stand right there. Okay, so your balance is good. Your gait is fine. It's normal. Okay, so what we're going to do next is the Romberg test. So what I want you to do is stand with your feet apart, about shoulder width. Okay, and cross your arms like this. Okay, and just keep them crossed. Cross your arms like this, and just stare at the wall. And I'm just going to observe you for about 30 seconds. Okay, just stand just like that. And the next thing I want you to do is um, continue to stand like that, but with your eyes closed. Okay, and I'm going to stand in front of you with my hands just to make sure you don't sway. Okay, if I notice that you are swaying, I'm going to tap you on the shoulder. Okay, just standing here, just for safety reasons. Okay, make sure you don't fall. Okay, all right, you're good. You can let your arms down. Okay, all right. If you can have a seat for me. Okay. One of the things I forgot to do was I wanted to check your hearing. Okay. Do you have any problems hearing? Any hearing loss that you've noticed? Okay. All right. I'm going to whisper a number in this ear, and you tell me what number it is, and I'm going to whisper a number in the other ear, and you tell me. Okay.
Okay. 4.
Mm-hmm.
3.
Okay. Perfect. Okay. All right. Well, I think this concludes our assessment. Do you have any questions or concerns? No. Okay. All right. Well, it was a pleasure meeting you. And just let me know if you do have any questions. I'm going to step out while you get dressed.
Oh, okay.
Okay. You're welcome.